I don't know if this would be the second wave at this point, but certainly the second peak of the virus outbreak in the country. Just wanted to start off with getting your perspective on how things have been going there.
Yeah, it is difficult, isn't it, to talk about the number of peaks or waves, because in the United States, we don't have one pandemic. We have 1,000 different pandemics, because the jurisdiction or responsibility for combating the virus has been left to local public health offices and states and local municipalities. So there isn't a systemic unified approach. And as Mike Osterholm has said, we're essentially playing whack-a-mole. As soon as we get control over here, it flares up there because we're not controlling it. And it is going to keep doing that. The virus is going to spread around to wherever things are relaxed. And unless there is a central, everybody do the same thing at the same time approach, that is going to continue to be a problem.
Have we seen any regions off the top of your head really that have sort of set a consistent model? Because I know with myself being in New Jersey, certainly for a while, our cases were very reduced. And obviously after facing mass exposure early on in late March, mid-April, we're now at a point where cases have sort of increased threefold, daily new cases. Has there been even just a particular state that we need to look at as a model, or is this something that we need to sort of accumulate some best practices across the board?
I think many states have effectively handled their initial peak only to see it return. California has had a massive decline from peak. Things are starting now to go back up. This is the whack-a-mole phenomenon. We're in an interconnected world, in an interconnected country. And one state that's doing really well today, next month will not be, because the other states weren't doing really well and it's spread. Until there is a unified national response, it is going to keep firing up wherever we're not paying attention to. Countries that have done well are countries that have had a national unified response.
Certainly. And something else that an epidemiologist touched on with me last week, actually, in discussing that in terms of replicating models from other countries, and I've been hearing it more and more, obviously, is that when we look particularly to countries maybe in Asia who have, I guess, the unfortunate experience of previously dealing with outbreaks and, SARS, MERS, other instances where public health measures had to be in place, appropriate spending was very evident in terms of testing and isolation care, and just priorities were set straight from the get-go. Their discussion basically being, if we're not going to follow the models set by these countries, we need to at least follow their mindset of being prepared the next time around. And it seems like we're in a spot where, if we're talking about such a highly contagious disease, we're into month 8 of outbreaks and rising concerns again. I feel like we should be applying these lessons learned on the run right now, right?
2 years, 3 years, 4 years, 10 years, 20 years from now, I'm sure that our situation will have been autopsied to death. There will be commissions, there will be reports. The reality is that in the United States, not dissimilar from, unfortunately, many countries right now, we are hyperpolarized. And until we get past yelling at each other at the extremes, we're not going to be able to come together and create common understanding that leads to implementation of the solutions that you're talking about. In other words, our problems are not scientific. Our problems are political. Our problems are civil discourse. You can't get everybody to agree to do something if everyone is so busy yelling at each other because they won't share a common framework of understanding.
Yeah. Certainly. So, I mean, just beyond the issues of, basic science parameters becoming politicized, which is obviously.
Yeah, it is beyond that. This is everything is politicized in this country right now. There's different parts of the country with different belief systems, and they won't talk to each other. And that leads to an inability to create a national plan. Now, will that change if an administration in the White House changes? We can hope so, but I don't know. We've become very polarized in this country. We need to work together to become less polarized. I recently finished reading a biography of Catherine the Great by Robert Massey. Wonderful book. Catherine the Great was an amazing leader. She was a true autocrat. She had life or death power over the citizens who lived in Russia. And she was also beloved. She was very much beloved by her population. In the middle of her reign, there was an outbreak of plague.
Right.
Killed 1 in 3 people, much more deadly than what we're facing now. So you have an autocrat who was beloved by her people, combating a much deadlier disease than we have now. She implemented quarantines and her people rioted. That's 250 years ago. This is part of the human character. We need to start realizing in order to get people to do what we want, we have to reach people in ways to tap into the psychology and maybe try different approaches than what we've been trying thus far.
And if I remember correctly, right, she famously was one of the first like national leaders to indoctrinate herself, right? She took a vaccination to safety.
Yes, that is correct. She believed very intensely in the power of science.
Right.
She believed intensely in the power of vaccines.
Mm-hmm.
She, before there was public health, was quarantining people, but people got mad at her. And this was someone who they loved and who had life or death power over them.
Yeah.
So we have to respect and understand human nature if we're going to get people to do what we want them to do.